Good afternoon, and welcome to this webinar on antimicrobial resistance, where we will delve into how well Europe is doing to tackle this very present and growing threat. I'm Helen Collis, a journalist for Politico, and I will be moderating this event for European Antibiotics Awareness Day, hosted by the European Centre for Disease Prevention and Control. We have an excellent lineup of speakers today from across Europe. There will be some time to ask them questions, so I do encourage you to write any questions you have in the Q&A box to the right of your screen. I'll do my best to get to them all. If you hear something you'd like to share on social media, please use the hashtag EAAD. I'll be looking at some of these messages as we go through the webinar. We have a lot to cover today, so we'll move straight on to our opening remarks from Stella Kyriakides, EU Commissioner for Health and Food Safety. During her time, since the start of her mandate in December 2019, Kyriakides has had antimicrobial resistance as one of her main priorities in DG Santé. She has driven for further action in a One Health approach to ensure more prudent use of today's antimicrobials and to push forward innovation in different areas to tackle AMR. Stella, if you are with us now, the floor is yours. I know Stella was hurrying from one meeting straight to the next one, so I'll just wait to see if she's been able to join us. Okay, it doesn't look like Stella's been able to join us just yet. So without further ado, we'll move straight into our first presentations. We actually have 5 speakers joining us next, who are all leaders in Europe's healthcare policy making, regulation and oversight, and play significant roles in driving forwards the agenda to tackle antimicrobial resistance. We will now hear from the speakers for about 10 minutes each on what they are doing in this space, followed by a panel discussion. Our first speaker is Dr. Andrea Ammon, Director of the European Centre for Disease Prevention and Control. Andrea will provide an update on where things currently stand in Europe when it comes to drug-resistant infections and how well countries are doing to reduce antibiotic consumption. Andrea will also be looking at how well Europe is doing when it comes to the European Council targets that were set out in recommendations to combat AMR last summer. Andrea, the floor is yours.
Thank you, Helen, for the introduction, and good afternoon to all of you, and thank you for attending this event for the European Antibiotic Awareness Day 2023. Next slide. Can I have my slides, please? Yeah, and the next one, please. So antimicrobial resistance remains a major public health threat in Europe and globally. And to address these AMR challenges, the Council of the European Union adopted this year in June recommendations for stepping up the EU actions for combating antimicrobial resistance in a one. So the fact that such recommendations were adopted actually for the first time setting targets shows that there is a high level of consensus among EU member states, that all understand that AMR is a serious health threat and immediate actions are needed. These council recommendations include 5 targets related to antimicrobial resistance and antimicrobial consumption. They should be reached by 2030, using 2019 as a baseline. These targets present an effective way to monitor the progress and to achieve the goals related to prevention and reduction of antimicrobial resistance, because they are concrete and measurable for the EU and also for each member state individually. And ECDC has been given the mandate to monitor the progress towards these targets. Next slide. Oh, this is already, thank you. Last Friday, and as every year for antibiotic awareness, ECDC published 2 reports with updates of surveillance data for the EU EA in 2022. One on antimicrobial resistance, and these are data from the European Antimicrobial Resistance Surveillance Network, EARSnet, and the other on antimicrobial consumption. These are data from the European Surveillance of Antimicrobial Consumption Network, ESACnet. And these data from 2022, published last Friday, present the first milestone, monitoring the progress to reach these targets at EU and member state level. And these reports confirm the large differences in antimicrobial resistance and consumption between the EU countries. Now let's see where we are and where we stand. So the first target for the EU is a 5% reduction by 2030 compared to baseline year 2019 in the incidence of bloodstream infections with carbapenem-resistant Klebsiella pneumoniae. Klebsiella pneumoniae is a cause of infections in healthcare and is a free hospital outbreaks if appropriate prevention and infection control measures are not taken. Now, when Klebsiella pneumoniae is in resistance to multiple antibiotics, including the last line group of carbapenems, there are very few effective treatments left for patients infected with these bacteria. Next one. Alarmingly, the situation in the EU for this pathogen continues to deteriorate. I think it's visually quite clear from this picture with the amount of red that you see. The incidence of bloodstream infections with carbapenem-resistant Klebsiella pneumoniae increased by almost 50% between 2019 and 2022. And this goes, of course, against the goal of reducing these infections by 5% by 2030. And this is the most preoccupying and worrying trend. What you can see is that some countries actually reached the target already. And you see the wide difference between these countries. But it's also visible that it's only 8 countries already reached their national targets. Next one. The second goal is a 15% reduction by 2030 and for the EU overall in the incidence of bloodstream infections with methicillin-resistant Staphylococcus aureus. So next. In this slide, you see that between 2019 and 2022, the incidence of MRSA bloodstream infections in the EU decreased by about 12%, which is very close already to the 15% reduction target. While individually 14 member states showed a decrease and 12 of these already reached their national target, another 13 member states showed an increase, moving away from their national targets. Target 3 is a 10% reduction in the incidence of bloodstream infections with third-generation cephalosporin-resistant Escherichia coli. Now here, between 2019 and 2022, this incidence decreased by almost 17%, indicating that the has already reached the 10% reduction target. Individually, there are 19 member states showing a decrease, and 15 of them have already reached their national targets. Another 8, however, showed an increase, moving away from their national reduction targets. Obviously, and as for the other IMR targets, there's a wide variation between the countries regarding their AMR situation. Now, the last 2 targets are on antimicrobial consumption. The fourth states that there should be a 20% reduction by 2030 of the total consumption of antibiotics in humans. And that combines all sectors, community and hospital. Next one. Here, between 2019 and 2022, the total consumption of antibiotics in humans in the EU decreased by 2.5%, indicating a very slow progress towards the EU target, with only 5 member states having already reached their target, and 12 member states showing an increase rather than a decrease. So what we can see is that after an unprecedented reduction in 2020 and 2021, antibiotic consumption in humans has rebounded in 2022. That might indicate that patterns of winter respiratory viruses, social contacts, hygiene habits, and antibiotic prescribing practices may now be similar to what they were before the pandemic. Next. So to better understand these changes, ECDC conducted a specific analysis of the rebound in antibiotic consumption. In 2022, compared to the changes in 2020 and 2021, focusing on the community. The results that were published in Eurosurveillance last Thursday show that while the rebound in antibiotic consumption happened in 2022 in 20 countries, in another 6 countries, the rebound had already started in 21 and kept increasing. And in one country, community antibiotic consumption regularly during 2020 to 2022, and there was never a decrease during the COVID-19 pandemic. Next. Finally, the last and 5th target is about ensuring that at least 65% of the total consumption of antibiotics in humans comes from the access group of antibiotics as defined in the AWARE classification of the World Health Organization. And antibiotics in the access group should be the first choice for common infections because they are contributing to a lesser extent to the emergence of antimicrobial resistance. So in this slide, you see that for the EU overall, the percentage of access antibiotics was only about 60%. And only 9 member states had reached or exceeded this target. All other member states were at various levels below the target of 65%. Next. I want to emphasize that the EU progress can only be as good as the sum of the progress of each individual member state. And some member states are more advanced in meeting the recommended targets or already met them. Other member states must continue with sustained or even increased efforts. Overall, increased efforts to reduce unnecessary antibiotic use and to enhance infection and prevention and control practices are imperative to reach the 2030 targets. So what we are urging, therefore, is action on to ensure measures to support prudent use of antimicrobials in healthcare settings, long-term care facilities, and the community. Second, strengthen infection prevention and control measures and policies in healthcare settings, long-term care facilities, and communities. And lastly, promote the development and accessibility to novel antimicrobials and alternatives to antimicrobials. Next one. So in conclusion, ECDC will continue working together and provide the data, evidence, and recommendations, including now an annual monitoring of progress towards these targets, so that the member states and also the Commission can take the necessary actions to address antimicrobial resistance at national and European level. We are all responsible. All actions from everybody at all levels, individual, professional, healthcare, national, regional, government, and so forth, count if we want to succeed. And so it's up to all of us, every single one of us, to ensure that antimicrobials, including antibiotics, will keep working also in the future. Thank you.
Thank you, Andrea, for that presentation and for giving us a real snapshot of where Europe stands currently with the targets that were set earlier this year. I think it really highlighted that in some areas, including in areas like bringing down the rates of bloodstream infections with the drugs-resistant Klebsiella pneumonia that you mentioned, there really is quite a lot of work still to do. But thankfully, some areas, for example, in reducing rates of bloodstream MRSA infections, Europe is already on track to meet the 2030 target. So it's a real mixed bag of information you provided us there. Next up, we are joined by Emma Cook, the Executive Director of the European Medicines Agency, who will speak to us about how antimicrobial consumption targets in animals support the One Health approach, which includes human health. Emma will provide an update on what actions the medicines regulator is taking to monitor the sales of antibiotics in animals and why this is important. Emma, the floor is yours.
Thank you very much, Helen. Thank you very much to ECDC for organising this event on Antibiotic Awareness Day. Very important that we highlight not only the goals but the actions. So I'm really grateful for the opportunity to update you on what we're doing on antimicrobial consumption targets, but also on some of the other work that EMA is focusing on to help to support a One Health approach. Now, just before I start, I wanted to just talk a little bit about AMR being characterized as a health crisis called, and it's often called the silent pandemic. And I think this is a bit of a misnomer because we really need to stop the silence. We need to combat antibiotic resistance by raising awareness. So we need to shout out and not be silent. And it's really important that we cover the full context of this health threat and the cost to our societies, because since their introduction, antibiotics have been the weapon of choice against many types of infections, and we've become dependent on them and we've taken them for granted. And if we don't get the answer right, we will go back to the pre-antibiotic era, and this means that the efficacy of life-saving antibiotics, antivirals and antifungals that underpin modern medicines will be lost. And it will mean that even the routine medical procedures are risky. Now, we were warned about this. We were warned about this in 1945 when Sir Alexander Fleming said that the time has come when penicillin can be bought by anyone in the shops. Then there is the danger that the ignorant man may easily underdose himself and by exposing the microbes to non-lethal quantities of the drug make them resistant. And this is what has happened. Overuse and inappropriate use are among the main causes for how things stand today. The cost of AMR to healthcare systems in Europe is estimated about 1.1 billion euros. And we estimate that AMR-related deaths could reach 10 million people by 2050. Next slide, please. So I really wanted to tell you what we at EMA are doing and why it matters. And this slide gives you an outline of some of our activities. There are different strands of the EMA response that contribute to the EU One Health Action Plan. And in terms of animals and veterinary medicines that I was asked to talk about today, our role covers the collection of data and the monitoring of consumption. And we've also got additional specific actions that we undertake as part of the recent EU veterinary regulation to help us promote responsible use of antibiotics. So some specific examples of how we target our approach to AMR. We've expanded our assessment procedures involving antimicrobials to non-EU regulators under the Open Initiative. We also use real-world evidence to monitor prescribing of antibiotics in humans using our Darwin Initiative. And by better understanding how doctors prescribe, we can target measures to optimize the use of these products, maximize their benefits, and minimize the uses that might cause resistance. So this is really the essence of the One Health approach, combining different approaches to address the problem and including everyone, as Andrea has said. We know from the work that we're doing that the more we work together and the more we collaborate, the more we can achieve. Next. So today I want to focus on our work on monitoring consumption data in animals, and this is the European Surveillance of Veterinary Antimicrobial Consumption project. Many of you will be familiar with this. We have been monitoring the sales of veterinary antimicrobials in Europe as part of a surveillance initiative, the SVAC project, since 2009. It started with 9 countries. And since 2017, it's moved to 31 countries. So that means that 31 European countries are working together on this project. It's very important. So the focus of this is on food-producing animals, and the feedback from the consumption exercise is very important for policymakers because it helps us assess trends in antimicrobial consumption and helps us then monitor adherence to responsible use policies. Next slide, please. So if we know the extent and use of antimicrobials, knowing the extent and use of antimicrobials is key to tackling AMR, and a more responsible and prudent use of antimicrobials in animals through well-established surveillance programs on antimicrobial consumption and resistance are critical, both in Europe and beyond. And in terms of data, you will see from this slide that we have very, very good news to share. The results are significant. Our joint work with European countries has led to a decrease in sales of veterinary antibiotics. And since we started the reporting, we have more than half the consumption up until 2021. Next slide, please. The collection of reliable data on antimicrobials sold for use in animals provide countries with valuable insights on their impact and the impact of their mitigating measures. And I showed you the decrease, the 50% decrease in the following slide, but you see even in the last year, 2021 to 2022, we see a 13% overall decrease compared with 2021. Next slide, please. So if we look at some individual products, some really critical antibiotics, we see very, very important decreases on the trends. We've 50% for 50% reduction for 3rd and 4th generation cephalosporins, more than 80% for polymyxins, 25% for fluoroquinolones, and 90% for other quinolones. So very, very impressive results. The key message here is that if we can reduce the antibiotic classes used to treat serious infections in people, we can save lives. So we're seeing the impact of monitoring and surveillance on the animal side, and we know that this translates into a reduction in the number of antibiotics used to treat humans as well. Next slide, please. Now, a couple of other activities that we're doing. Again, many of these are stimulated by the new veterinary regulation that came into force in 2021. We've updated the categorization of antibiotics for veterinary use, and this helps to guide veterinarians in choosing the most appropriate antibiotic for their needs. Our veterinary teams actively implement the new veterinary medicines regulation. For example, the use of antimicrobials in animals to prevent disease is only allowed in exceptional circumstances. The use of some antimicrobials in animals is even banned to ensure that these antimicrobials remain effective for treating people with certain conditions. We also work on the possibility of alternatives, and you may be aware that we've recently adopted a guideline on the quality, safety and efficacy of veterinary medicinal products specifically designed for phage therapy. Again, this is just an example of some work that we're doing to promote the authorization of alternatives to antimicrobial veterinary medicines. Next slide, please. So, to conclude, to really have impact, we need to work together. This is what the One Health concept is all about. We see impressive results in the animal area, working with EFSA, with ECDC and others, and we see how we can make a real difference by monitoring sales and consumption. The less we use antibiotics in both human and animals, the lower the risk of antibiotics becoming resistant. The new veterinary regulation, which came into force in 2021, includes many initiatives designed to reduce use and preserve effective antibiotics for use only when necessary. But education and awareness raising is key. The overuse of antibiotics is what makes resistant bacteria more common, and it's therefore imperative that we raise awareness about antibiotic use. We still see a worrying lack of knowledge about antibiotics, and we need to think hard about different ways to get the message through. We know that many citizens think that antibiotics are effective against viruses. So as a network working together, we need to educate, promote awareness around antibiotic use so that antibiotics remain effective. And we at EMA, we provide recommendations on what all of us can do to make sure that antibiotics remain effective. Let us use this conference today to share insights, thoughts, and experience and solutions. Together, we can develop a comprehensive strategy to address AMR effectively and preserve our ability to treat infections and save lives. Thank you very much.
Emma, thank you so much for that presentation. I thought it was incredibly interesting. I also think it really shows that when it comes to AMR, the progress made in antibiotic consumption in animals over the last decade has really come a long way, and especially thanks to the new regulation that you discussed. But as you just mentioned, there is a real need to raise awareness to really prevent the unnecessary use of antibiotics across the One Health approach. Next, joining us for a discussion is Francesca Colombo, Head of the Health Division at the Organisation for Economic Cooperation and Development, or the OECD, who can bring a broader economic perspective to this discussion. Francesca has studied the cost of antimicrobial resistance for the EU and EEA countries and can explain how embracing the One Health framework can safeguard the health of the population and generate economic gains. Francesca, the floor is yours.
Thank you, Helen, and thank you so much for the opportunity to be here and present some of the results of a report that we recently published, which is looking at embracing a One Health framework to fight antimicrobial resistance. And first of all, I obviously completely agree with what my previous speakers said and what Emma reminded us. It should not be called as a silent pandemic. It's silent because somehow it seems to be a little bit more forgotten, but we should be very vocal because the consequences, both the health and the economic consequences, are very, very significant. And also let me thank very much the partners, all the collaborations, very good collaboration that we have with the ECDC and all the other organizations, the commissions in Europe and beyond. If we can go to the next slides. And that's my first point. It's actually that the antimicrobial resistance is already here, and the pandemic is in a way already affecting us. If we look at data from 2019 about the resistance proportions in EU and EEA countries, that stood already quite high at 22%. So it means that 1 in 5 infections is already resistance. And if we project that towards the future, it's true that on average for the EU and EU countries, we see a slight decrease that you see on the right with the arrow, which I pointed to. But you also see that about a third of the EU countries will actually see a rise in antimicrobial resistance rates by 2035. So in a way, there is no room from compliance. It's something that we need to keep on working on. Now, if we can go to the next slides, which is one that really strikes me very much. It really looks at what is the arsenal of antibiotics that we have. And the message here is very clear that we are exhausting our antibiotic arsenal. And these slides look at across EU and EU countries, the resistance to last-line antibiotics, so the second and the third line of antibiotics, and how this is forecasted to evolve by 2035. And again, these are analyses that we have done at OECD using a combination of machine learning techniques and looking at all the data available to power that machine learning technique estimates. I find it particularly striking to see how the third line antibiotics resistance will more than triple between now and 2035. That's really quite scaring because those are the antibiotics that are used when nothing else will be working. And even when we look at the second line of antibiotics, between 2005 and 2035, we see an increase of 25%. So again, it's no room from compliancy. We could find ourselves in a situation in which a lot of the standard procedures, which are common practice in medicines, will no longer be safe. Now, if we can look at the next slides, antimicrobial resistance does have significant costs, and those costs are both for the health, but also more broadly for the economy. So resilient infections put the European hospitals, and that's just an illustration of that cost, under significant pressure. If we look at patients that develop resistance infections, they are more likely to remain for longer periods in hospitals, to have higher rates and risk of complications, to require more intensive type of treatments to recover. And all of this does create additional pressure and costs on hospitals. We have estimated, for example, a cost ranging in the order of 9.5 million extra days that would be spent in hospital across the EU and EEA countries per year due to antimicrobial resistance. Now, this is a really quite high number. They are equivalent actually to using the entire acute bed capacity of Portugal in 2020 for a whole year. So it means really that those precious resources that we have, like hospital beds, hospital resources, will not be available to treat patients for other type of needs that they have. The opportunity cost, therefore, it's incredibly high. But if we look more broadly at the next chart, our analysis also look at the costs that go beyond the health system itself. If we look at what happened to individuals that would lose days at work or be less productive at work, and we calculate and estimate the cost of all of that, we see that a significant amount of resources is spent in addressing that productivity loss. And this graph shows estimates for the EU and EEA countries about what would be the cost, the extra health expenditure and the total productivity costs that would be linked to antimicrobial resistance. We are talking of something in the order like of 6.6 billion lost due to extra health expenditure, which are incurred in treating resistance infections, and a cost in terms of economic losses in the order of 5.1 billion. So these are really quite a high number that are equivalent to something like 1/3 of the GDP of a country like Estonia. Now, we do have ways to address the growing rates of antimicrobial resistance. If we go to the next slides, it's quite clear that maybe just if you can show all of the, if you click maybe and show, no, it does not show the previous, well, leave here, somehow it does not show the slides. But we do need to have a comprehensive policy action to address antimicrobial resistance. And in these slides, what it was supposed to be shown is the priority policies that can be put into place that range from strengthening prevention to supporting stewardship program to strengthening antibiotic use surveillance systems to enhancing policy actions in terms of food handling in a One Health approach and so forth. And if we can go to the next slides, well, there you go. If you can go to the next slide. We can consider, and we have done analysis through our work that identifies a number of policy action, specifically 11 One Health best buys that could be implemented to tackle antimicrobial resistance. And so those would be things that would be very familiar to you. There can be a series of policy actions that can be clustered, all categorized in 4 different categories: those that relate to promoting prudent use of antibiotics in humans, those that relate to prevent the spread of resilient infections, those that relate to promoting antimicrobial resistance awareness and understanding, and the One Health policies. Now, all of those actions we have used to try to model them and to see what would be the cost effectiveness of implementing these policies. And the results are shown into the next slides that look at implementing all these best buys in a very systematic ways, and estimates what would be the implications in terms of population health, which is shown on the left, and in terms of economic gains. And as you can see with these slides, the significant number of deaths can be averted on an annual basis from implementing each of those interventions. Is significant. Is particularly high for resistance infections. So when we look at improving antibiotic stewardship, as well as enhancing environmental hygiene and improve hand hygiene, but also when we consider susceptible infections, the potential death averted are very significant for pretty much all the interventions. But the economic gains are also particularly high, and this illustrates that there are significant gains that can be made by implementing each of these interventions individually. But if we look at the next slides, there are an additional possibilities that come from interventing all these interventions, not individually, but as a package. And so in our analysis, we consider 3 different types of packages. I show in these slides one, which is a mixed package of antimicrobial stewardship program, enhancing hand hygiene, delayed antimicrobial prescription, mass media campaign, and better food handling practices. We have also done the same for 2 alternative packages, one related to hospital-based interventions and the other based on community-based package. The main message from these slides, which shows the results from all the countries, is that the cost of implementing a package in each of the country, which is the blue line on top, are actually lower than the economic gains in terms of productivity gains and health expenditure savings. And that's pretty much the case for nearly all the countries. So there is an overarching return if we look at all the countries considering in terms of $1 or €1 invested, generating returns in the order of 3 in terms of health economic gains annually. So if we go to the next slides, I will just conclude by saying that, yes, this silent pandemic is not and should not be very silent. There has been significant gains in terms of antibiotics consumption, particularly in the animal sectors, agricultural sector, as it was mentioned, but in Europe also when we look at the human sector. But there's no room for compliances. Resistance proportions are already high, and they will, without any significant action, become even higher. And we know what to do. And the gains, both the health and economic gains from the interventions which can be implemented individually, but more fundamentally as a package, are very compelling. So there is probably no room for compliance, and we need just to keep on stepping up with the interventions and the actions. Thank you very much.
Thank you, Francesca, for sharing your research with you. I think that was a really fascinating look at where AMR really impacts the budgets and the economic models across the countries. I thought one thing that was really striking was the impact of the interventions on preventing deaths and the impact that just improving hygiene measures could really have in that area. Next, we go to a presentation from Guillaume de Sez, Head of the Risk Assessment Production Department at the European Food Safety Authority, or EFSA. He will provide an update on EFSA's activities related to AMR, and in particular, Guillaume will speak about antimicrobial resistance in food-producing animals and how these infections in animals impact the health of people. Guillaume, the floor is yours.
Thank you, Helen, and thank you very much, ECDC, for organizing this event. So I will present the work of EFSA in the field of antimicrobial resistance. The mission of EFSA is to provide scientific advice to risk managers on risk in the food chain, risk to human health in the food chain. And in this remit, EFSA looks at the possible emergence, the spread, the transfer of AMR in the food chain, especially in food-producing animals. And this work is part of a One Health integrated approach to the issue of AMR, to fight AMR in the human health context, because animal production is one of the compartment in which AMR can develop and spread. And food from animal origin are therefore one of several possible routes of exposure that humans have to antimicrobial resistant bacteria. So this is really part of a One Health approach. Next slide. So you see on this outline of my presentation that the work that EFSA does is really a lot about surveillance in many dimensions. So first, I'll say a word about the monitoring report that we produce every year with ECDC on AMR. I will give some very short highlights of our findings in this report, including emerging signals, and also looking at what we do for continuous improvement, both in terms of methodology and in terms of data communication and use. And finally, I will extend a little bit the scope, looking beyond animals, food-producing animals, to look at food system in general, and how we are starting to look at antimicrobial resistance in this broader context of food system. Next slide. So the annual report, every year, EFSA and ECDC work together with the member states of the European Union and other reporting countries. The member states and countries collect data on zoonotic bacteria, Salmonella and Campylobacter, as well as on E. coli indicator bacteria and on MSRA. So the data is jointly analyzed by EFSA and ECDC in a One Health approach, integrating the analysis across humans, animal, and food, and comparing the resistance and the resistance profile across animals and humans. So the goal of the report is really to understand the development and spread of resistance, to, since we do it every year, follow trends, see how well we are doing or not to meet the reduction goals, and also to compile all this data into high-level indicators that can give quick indication to answer a question like, are we improving or not, and inform the effectiveness of policy intervention or the need for more policy intervention. And finally, and I will come back on this, we also look in this report at emerging resistance that can appear. Next slide. Yes, the occurrence of resistance. So in a few words, what we find out in the latest version of the report is that the commonly used antimicrobial substances are frequently resistant, is frequently observed across all animal species. The level of resistance to critically important antibiotics vary quite a lot from one animal species to another, and we find some higher resistance to some antimicrobial classes like the fluoroquinolone, which are observed in poultry, for instance, higher resistance than to pigs and calves. So what you see here is one bacteria, Salmonella, and an example of how we data we collect, data we analyze, and how it is reported. So per category of animal, one color per class of antibiotic. So what we see here, as I was saying, if you look at the three antibiotic classes, ampicillin, sulfonamide, and tetracycline, there is already high resistance in all animal classes, but some better news on where we see low or very low resistance to third generation cephalosporins, the CTX, and also good news is that we have low resistance to combined antibiotics, the combination of ciprofloxacin and cefotaxime. Next slide. Another bacteria we looked at is Campylobacter. And so you see also here, same picture, the data is presented in a different way by class of antibiotics. And what we can see here is that we have high resistance in the two strains of Campylobacter that are reported here, high resistance to tetracycline and also to the ciprofloxacin, which was also reported, we saw for Salmonella. And better news for two other data that are reported, the erythromycin, which is still low in at least for sure in one of the strain, and also low resistance to the combination of ciprofloxacin and erythromycin. Next slide. Yes, so you can imagine that given that we get data on many different categories of animals, many different families of antibiotics, all member states country and other reporting countries, that's a lot of data to look at and to grasp the meaning of. So it's of course very important to develop simple indicators, aggregating the data in a way that they can give quick, simple answer to especially risk managers to understand the need for policy action, the effectiveness of the ongoing policy action, and the need to refine or develop new measures. And for AMR in food-producing animals, we look in particular at two indicators. The first one, it's in the next slide. This is the we look at E. coli who have full susceptibility to a predefined, sorry, it's in the previous slide. E. coli who have a full susceptibility to a defined panel of antimicrobial substances. And you see here on the right, so this is the data reported in the past few years for all reporting countries, member state and reporting country. So the first thing that is apparent in this series of graphs is that there is a high variability between member states. And remember, this is E. coli with full susceptibility to a panel of antibiotics. So high bars is a good sign. We want this indicator to be high. So a lot of variability. The good news here is that we see that this year we have 55% of member states who report an increased trend over the past few years in this indicator. And that's not only starting to be relatively good, majority of member states are increasing this indicator, but it's also increasing year after year. Since last year, we had 44% of member states and reporting countries. And also the year before that, 2 years ago, we had only 25%. So this indicator is on a good trend. Next indicator is an indicator we have to look at the prevalence of E. coli who are producing some resistance mechanisms to antibiotics. So the ESBL and or AMPC producing E. coli. So here it's a bit confusing. We want this indicator to be as low as possible. So a small bar is a good news. We see here again on the right-hand side that there is a lot of variability from country to country. But overall, it's also good news since we see that in the last few years, we have 63% of countries for which the indicator is decreasing, which is an improvement compared to last year, 55%, and the year before when we have 48%. So on those two indicators, we are doing pretty good. So the next slide. So the last aspect I wanted to highlight of this report, it's the emerging signals. And here it's not good news. So because on one of the signals we are tracking, which is the resistance to last resort antimicrobials for humans, we look at this family, which is critical of carbapenems, and we see emerging resistance in animals over the last few years. It is still relatively low, but it is now established since we see signals in different categories of animals in the last few years. And also the genetic determinants are consistent with some of the one we find in humans. So this is a signal that is worrying and which needs to be investigated further, and we are starting to prepare for digging into this. Next slide. So this is in a nutshell what we find in the last version of the report. I want to say a word also on how we are continuously improving methodology and communication of the data, or usefulness of the data. So looking at communication, methodology first, is on the next slide. So we've done a lot of work with ECDC to integrate whole genome sequencing into our work. So we developed a protocol and then reporting guidelines. And this is very important because, no, this is still on the previous slide, sorry. Yeah, thank you. So the whole genome sequencing enables to a much more sensitive analysis of the data and gives more, of course, analytical power to the MR epidemiology studies. So that's why we are investing in developing this methodology, in making it adopted by more and more member states. It's growing. You can see we have now 7 member states who started to report their data with whole genome sequencing. It's still low. It's still too low. So we need to accelerate there, because this is really the future to get a better understanding and better grip on the signals and the trends that we want to measure. The next slide is the work we do to continuously improve communication. Emmer Cook mentioned we should not let AMR be a silent pandemic, and I think we all agree on this. Very important work on communication, on making our results more easily to find, more easily to understand and to use. And that's why we have also invested in the past few years to create dashboards, to create story maps on the indicator of AMR, also visualization tools that allow a greater interactive use of the data country by country, so that really the work we do can be better understood, better spread in society, so that the importance of this pandemic is realized and acted upon. Continuing with my next slide. So here, I think the last thing I want to mention is the evolution of our AMR work in EFSA, which we are doing to support the European Commission Green Deal, the objective of transitioning to food systems that are more sustainable, and I have a few examples in the next slide of how we are investigating AMR beyond the domain of food-producing animals to include other aspects of food system and the environment, so really extending the One Health approach. And I've put 4 examples here. You see the first one, we are looking with 4 other agencies in the European Union in charge of human health and the environment, including EMA and ECDC, how the use of pesticides for agriculture and biocide to combat azole, the use of these azole fungicides, how they can drive AMR resistance in aspergillus, which are responsible for human infections. So this is work in progress, very interesting work with, as I said, 5 agencies in a complete One Health approach. The next example is we are investigating how AMR can be spreading through the use of reclaimed water or the reuse of water. We know this will be a growing trend for resilient and sustainable agriculture, and we need to understand how this can contribute to spreading AMR. The third example is to look at aquaculture, AMR in aquaculture water and fish. You have noted that everything I reported about the AMR report is about terrestrial animals. We know aquaculture will have to grow to develop sustainable food system, especially land-based aquaculture. So it's important to early on start understanding how we need to monitor AMR in this type of setting. And finally, we are doing some work to look at plant pathogenic bacteria and how in some countries outside of the EU, antibiotics are used to combat plant pathogenic bacteria. And we are also looking at non-antibiotic alternatives to control them. So this is the expansion of the AMR work of EFSA. And as a conclusion, I wanted to quickly come back and mention a report we produced. It's on the next slide, that we produced with EMA a few years ago already. And I think other speakers talked about, there are 3 conclusions in this report, which is that we need to set targets to reduce the use of antibiotics. We need to replace them by non-antibiotics alternative. And other speakers have talked about those two goals. And I just wanted to mention at the conclusion the importance of another conclusion that was in this report, which is the rethink. And the idea here is to rethink the way food animals are raised, transported, slaughtered, so that we design animal food production from the start with a way of preventing the emergence of diseases, preventing their transmission and their spread. And in this context, the work that EFSA has been doing and is continuing to do on animal welfare is of critical importance, because this is by increasing understanding and setting food production system which take more into consideration animal welfare, that we can at the root prevent the need to use antimicrobials and therefore prevent the development of resistance. And I stop on this slide. Thank you very much.
Thank you so much, Guillaume. I think that was a really interesting presentation. And I was really interested to see just how much variation there is across Europe between the animals and the susceptibility, or the efficacy, if you like, to antibiotics across the countries in food-producing animals. I had a quick look. It seemed like there was a real difference between the Nordic regions, for example, with these drugs continuing to work, and some of the southern countries like Greece, Spain as well, and Cyprus having much lower susceptibility. We go to our next speaker, who is MEP Sarah Saras, a member of the European Parliament with the Socialists and Democrats group, who is also a member of the MEP Interest Group on AMR. Sarah has a keen interest in health policy. She is also a member of the European Parliament's Committee on the Environment, Public Health and Food Safety, and the Subcommittee on Public Health. The MEP Interest Group on AMR brings together MEPs from across the political spectrum who are working together to address antimicrobial resistance and to ensure that Europe positions itself as a global leader in the fight against this threat. Sarah, thank you for joining us. The floor is yours.
Thank you very much, Helen, and thank you very much for the ECDC for the invitation to be here celebrating the European Antibiotic Awareness Day. This is a very important to reflect on this very important topic. I understand a lot of my different points I wanted to raise have already been tackled by the previous speaker. I think by now we can agree that this is not a silent pandemic. It is a pandemic that we need to address it, and we cannot fall on the error of thinking a country can do it by itself or a region can do it by itself. It also needs global effort. Indeed, 70% of cases of infections with antibiotic-resistant bacteria were associated with healthcare associated infections. We already have seen the numbers. This will produce a lot of deaths worldwide, globally, and it's going to also affect our economy. And this is not only a pandemic, but it's also part of the climate crisis. And for that, in order for us to address antimicrobial resistance, we need to address it both in humans and animals. And here I would like to highlight ECDC's efforts to bring different perspectives here in this panel in order to keep pushing for a One Health approach and action plan in order for the EU to be an example region when it comes to protection of existing antibiotics, to advocate for AMR to be in the global agenda. It fell shortly during the pandemic, but I hope we don't lose momentum, and also to make research, development and innovation on AMR a priority. We have some really interesting news coming up with the discussions on the new pharma legislation. So what have we been doing so far? 20 years ago, the Council asked member states to recognize the need for more prudent use of AMR antimicrobial agents in human medicine. And in 2001 already, antimicrobial resistance was a cross-border health threat that will never be addressed by only one member state alone or one region alone. It needs a lot of cooperation and coordination. These little microorganisms do not see our borders, our human borders. In 2016, member states asked for a united plan against AMR in the EU. And at the beginning of this term, we have the interest group on AMR, as Helen stated. It gathers MEPs that are very much invested in making antimicrobial resistance a priority, and also work on policies that can tackle this pandemic. So we have dedicated work on AMR through different files, through different political, legislative and non-legislative files. Mostly, I would like to highlight the inclusion of One Health across most variable European policies. For instance, we have legislated on how to do surveillance on urban wastewater and ensure its safer release for the environment. For instance, we have stricter air qualities, and all of these are examples of how we can have a One Health approach, and also in other policy areas beyond health. The EU is one of the regions with the highest food safety standards. From production to consumption, we are able to create a safer environment for animal health and transport, plant growth and health, and contaminants and residues in soil and animals. And this is one of the best examples that we have of intersectoral cooperation and recognizing the interlinks of human, animal, and environmental health. As a member of the European Parliament and as a medical doctor in the field of public health, I have worked very hard to meet the objectives of the European Health Union, and we have developed very much a response not only to the COVID-19 pandemic, which had huge visibility with the joint purchase of vaccines, but also it highlighted the true collaborative achievement of the EU when we work together. Also in the EU for Health program, where we managed to increase tenfold the budget, we also managed to have a One Health approach in that program, and also a health in all policies approach. Also, we strengthen our regulations on serious cross-border health threats. We increased the mandate of EMA and ECDC on strengthening prevention, preparedness, and response planning, and also on strengthening epidemiological surveillance, data reporting, and EU interventions. The European Parliament also this year also adopted a resolution on action to combat antimicrobial resistance that was followed by the Council's recommendation on stepping EU actions to combat AMR through a One Health approach. Other advances have been made. We have the pharma package that will tackle issues where we need more information directed to healthcare professionals on use of these substances, but also ensure that medicines developed in the EU are sustainable and environmental friendly. Indeed, in this new legislation, there's going to be, hopefully, if it passes, obviously, an environmental impact assessment, which is quite important when we are dealing with antibiotics, antimicrobials. And the responsibility will be placed in the companies to ensure the sustainability of their proposed medicines. We also are working on incentive mechanisms for development of new antimicrobial substances, which will facilitate the development of priority antimicrobials provided for in the WHO priority pathogens list for R&D of new antibiotics. However, there's still a lot to be done. There's still a lot to be done in making the One Health approach a priority. We have been, I can state that I see the difference when I started my mandate in 2019 until now in the One Health approach. Back in 2019, it was very shy whenever one would talk about that, and now it's something that it's becoming more and more trendy and rushes. So, however, we have bigger emergencies coming out around the corner. For instance, this year alone, there has been more than 75 autochthon cases of dengue across Italy, France, and Spain. This is due to the different changes that we are facing in the climate, but what we are seeing is also that infectious diseases are making their patterns differently with climate change, and this is something that we need to be very much aware for, and hence reinforce the One Health approach to effectively address these environmental dimensions. For this, we must reduce the quantities of antimicrobials used, but also reduce the release of antimicrobials to the environment by either establishing effective barriers, not only in human health, but also when it comes to the animal use of antibiotics. And for that, it is of the utmost importance to hold the industry accountable on the climate goals set for the EU. Member states here play a very important role on strengthening their national action plans against AMR, on implementing effective surveillance and monitoring AMR consumption, on antimicrobial stewardship and prudent use of antimicrobials, and also on reaching the targets for antimicrobial consumptions. I'm very much hopeful with the new European health data space that it will also provide an opportunity for more research and innovation in this area. But we must not forget about the citizens and the importance of health literacy. It is of the utmost importance to increase awareness on AMR among the general population. And let me just share a beautiful example that I just came across yesterday. In Spain, there's a campaign about usage of antibiotics for a flu. And they state, if you are with the flu, you should hug a unicorn. It sounds ridiculous, right? It's as ridiculous as using antibiotics to treat the flu. So it's these types of campaigns that are very catchy, that can be used in order to raise awareness in the general population, have targeted campaigns, but also, and our main goal should be on increasing health literacy in order for people to make the most healthier choices for their own lives. And this is something that we have also inputted a lot in the different policies, health policies that we have been developing from the European Parliament's part during this legislature. So just to finalize, AMR requires a One Health approach. Our MEP interest group has made several advancements, but there's a lot more that needs to be done, but we can only reach it through joint efforts. And through only joint efforts, it will be possible to fight antimicrobial resistance and truly accomplish the European Health Union that leaves nobody behind. Thank you very much again.
Thank you, Sarah, for sharing with us what the European institutions have been doing legislatively and in other actions to really drive down rates of AMR. I particularly like that example from Spain on the public health campaign, and I'd be interested to see if that works. We're unable to be joined, unfortunately, by the Health Commissioner, Stella Kyriakides, but we do have someone who has stepped up to read her speech for us. So let me introduce Dominique Monet, who is head of the ECDC section for antimicrobial resistance and healthcare-associated infections. Dominique.
Yeah, thank you, and apologies from Commissioner Kyriakides. So I will read her speech. Ladies and gentlemen, colleagues, it's my pleasure to join you for this event to mark European Antibiotic Awareness Day. This is a great opportunity to look into the latest development on antimicrobial resistance and to remind ourselves of what still remains to be done. Each year, AMR kills more than 35,000 people in the EU and costs our economies more than 11 billion euros. We need to act without delay. Fighting AMR is now, more than ever, a firm priority of the Commission and the Member States. In June, the Council agreed on the new recommendation we proposed for antimicrobial resistance. This was a milestone. We now have national and EU targets for antimicrobial resistance and antimicrobial consumption, including a 20% reduction in our total consumption of antibiotics by 2030. Targets help us focus our energies and action. What gets measured gets done. As you will hear today, the ECDC data as you heard today, the ECDC data show that between 2019 and 2022, total consumption of antibiotics in humans decreased by 2.5%. We are making progress towards that 25% reduction goal, but it is too slow. We need to step up efforts and work together if we are to reach our targets by 2030. In addition to the ambitious targets, our recommendations also include measures on infection prevention and surveillance, in particular integrated surveillance that should be further developed. And to support these actions, we are investing 50 million euros to co-found a new joint action on AMR that will launch in early 2024. This will help member states, as well as Norway, Iceland, and Ukraine, to tackle AMR with a One Health approach. We're also providing 17 million euros to improve access to newly developed tools through an EU multi-country revenue guarantee. And across the EU, every euro invested on AMR interventions could lead to 3 euros in savings on health expenditure and productivity gains. OECD data suggests that if every EU-EA country invested 3.4 euros per capita each year, we could prevent more than 10,000 deaths, avoid over 600,000 new infections, and save more than 2.5 billion euros for our health systems. We're also making good progress on cutting sales of antibiotics for farmed animals and in aquaculture. The latest data show that sales of these antimicrobials were down by 28% in 2022. We are well over halfway to meeting our goal to cut use by 50% by 2030. However, there's still some way to go, especially in countries with the highest sales of veterinary antimicrobials. And to support these actions, we are investing 50 million euros to help here. The Commission is organizing hands-on training for European farmers and veterinarians. We're also providing more than 60 million euros to member states to help them improve their data collection and reporting. And of course, we should remember that health threats know no borders. A global response to AMR is essential. We want to lead by example and actively advocate for an ambitious approach among our international partners in the global fight against AMR. We need to keep up the momentum in the lead up to next year's United Nations General Assembly high-level meeting on antimicrobial resistance. So today, let's remind ourselves that everyone, health and veterinary professionals, patients and decision makers, has an important role to play in the fight against AMR. I hope you enjoyed this event.
Thank you, Dominique. We next go to our panel discussion, which will bring back all of our speakers that you've just heard. I'd like to stay with you, Dominique, actually, because I assume you're representing Andrea Ammon from ECDC as well. One of the things that Andrea said in her presentation was that there was an unprecedented reduction in antimicrobial consumption in 2020 and 2021. There was a real rebound in 2022. Do you know why that is? And does this latest consumption data concern you?
Well, there was, before the COVID pandemic, there was a small decrease year to year over for the EU with variations between countries, but there was a small decrease in antibody consumption in humans. And suddenly an unplanned event, the COVID-19 pandemic, happened, and there were a decrease in antibody consumption in most countries in 2020, 2021. And we attributed this to the implementation of what we call in our jargon non-pharmaceutical interventions, that is the lockdowns, the teleworking, the school closures, the fact that we had less and less social interaction with each other, and our children also had less social interactions. So that resulted in less transmission of communicable diseases, different patterns of health behavior. I mean, maybe it was difficult just to see a GP in some countries. And of course, this affected the antibiotic prescribing practices. So one of what we think now is that now we reach a phase of lower intensity of COVID-19 transmission. It's not over, but it's not as acute as it was in definitely 2020 and 2021. So it seemed that the patterns of transmission of communicable diseases, the social contacts, the hygiene habits, the antibiotic prescribing practices, everything is closer to where we were. So an unplanned event happens, affects consumption. We're back to baseline. At least that's what we believe. And if we look at the decrease that we've seen from 2013 to now 2022, as reported in our reports, we're basically back on the line that was happening before. So we need to do more if we want to reach the 2030 goal.
And another thing that Andrea showed us was that while we are seeing real growth in some areas of AMR, there are also some areas where we are seeing quite substantial declines in drug-resistant infections. I wondered if you could explain this really complex picture of AMR across Europe. And I'm assuming, we've got national action plans throughout Europe, and they must be being implemented by now. If everyone's taking these measures, why would we see such different results with some infections going up and some infections coming down?
So during the COVID-19 pandemic, when there was this decrease in antibiotic consumption, there was also a decrease in resistance in infections in the community. Makes sense, right? Mm-hmm. Less social interactions, less consumption, less resistance. There was a decrease in antibiotic resistance in infections that would happen in hospitals, but not in the most specialized units. And then in the intensive care units, the COVID-19 units, there was obviously difficulties with infection prevention control and an increase in resistance for those pathogens that are highly drug resistant and are responsible for healthcare-associated infections. We mentioned carbapenem-resistant Klebsiella pneumonia, and that was obvious on the data that I presented. But we saw this to a lesser extent to carbapenem-resistant Pseudomonas aeruginosa, also healthcare-associated infections. We saw a large increase in carbapenem-resistant Acinetobacter infections, also healthcare-associated, that we reported last year with a major increase in intensive care units. And these increases were really seen in the countries that had difficulties before the COVID-19 pandemic. In other words, the countries that they didn't know they were prepared, but they were prepared in a way because they already had good structures and good processes in place, and possibly more resources. Those countries had less difficulties keeping up with the infection prevention control. But the countries that already were struggling had difficulties. We showed this last year for Acinetobacter and also for a fungal pathogen that is often resistant to antifungal agents, Candida auris. So the differences were there before the COVID pandemic, and I think they were accentuated at some point during the COVID-19 pandemic.
I see. So it sounds like the pandemic has really had this moment of like you say, it's really accentuated where countries stood beforehand, and now it's really quite clear from the graphics that we saw earlier what impact that has had. I want to move to Ima next, and I want to take this opportunity to ask anyone joining us online to please submit any questions you'd like to ask our speakers, and we will try to get to them. I have one for Ima coming up, but first of all, Ima, I wanted to ask you a question about, personally, it looks like a bit of a success story from member states in reducing the sale of antimicrobials used in animals, a 53% decline in the last decade and 13% in the last, from 2021 to 2022. But what evidence do we have at this stage that the impact of this trend in animal consumption has had on AMR more broadly?
Good. Okay. Yeah. So I think this is the results are really impressive. So 53% since we started since we started monitoring, and then we see 13% in last year, or 21 to 22 alone. Now you ask whether what impact this has on the use of antibiotics in humans. Well, we can't correlate that directly, but what we can say is that if we do monitor, if we do this joint monitoring work together, and we see what an impact it has on the veterinary side, if we do something like this on the human side, we will also see impressive results. But I think actually some of the results that Francesca showed in her slides actually show that we've got quite a mixed pattern across Europe of consumption and impact on antibiotic use. And this is something that I really think we need to work on, because some countries are doing very well, but some countries aren't. And for me, this is if we could take some of the best practices from those countries that are doing well and apply them across different systems, I think this would make a real difference.
Mm-hmm, mm-hmm. And I just wanted to ask you about which animals specifically are all included in this the new legal requirement to collect more data. Does that also include pets? And I'm wondering to what extent they would impact the sort of what we know about AMR, and if they're really quite a significant part of the modelling.
Well, yeah. So we have we've been using the sales of antimicrobial medicines as a proxy for antimicrobial consumption, and we focused on food-producing animals so far. But the new requirements in the regulation facilitate collection of data on different food-producing animal species and also on different production sectors. So you're right, yes, that will include domestic pets, but it will also allow us to estimate uses in different types of chicken, for example, if they're laying hens or broilers. And in the future, once we have better data on the use in companion animals, one of the impacts on this will be that because people may acquire antimicrobial resistance from contact with not only from food-producing animals, but also with companion animals. So by having this more granular monitoring, it will allow us to have more targeted measures and help us to promote more responsible use in a very targeted way.
I see, and I'm just taking a question from someone in our audience here, from Diana Tixera. I'm sorry if that's not how it's pronounced. She's asking you, Emma, how do you think we can guarantee that the reduction in use in antimicrobials in animals won't negatively impact animal health and welfare? And how can we ensure animals that need treatment with antimicrobials won't be left to suffer or even die?
Well, I think this is the context behind all the measures in the veterinary regulation are all about trying to find the right balance. So it's always a balance between appropriate use of antibiotics, and we say prudent use. Because of course, yes, we have to treat sick animals. We have to be able to treat sick animals, but we have to avoid inappropriate use and make sure that we're really using antibiotics only in those areas where they're really, really necessary. And this is it's this concept that is behind the measures in the vet regulation, which allows us to restrict the use of certain antibiotics, to ban certain antibiotics, but still allowing the use when really needed.
Mm-hmm. And one more question from the floor, from Margarita, representing the FARG EU group. When she says, when we're talking about solutions for AMR, a number of experts mentioned the need to develop novel solutions, and this call has been repeated. And she's saying that the authorization process for innovative treatments is too burdensome, and it slows the access to innovation in the EU. She's saying that one example could be treatments and products based on bacteriophages, which she says are one of the most efficient ways to tackle AMR, not only in humans, but also in animals. I wondered what your thoughts are, firstly, on this approach. And she's asking what can be done at the EU level to facilitate the authorization process of innovative treatments.
Yeah, well, I think one of the things I mentioned in my slides was the trying to find alternatives to antibiotics. And I did specifically mention phage therapy. And I pointed to the guidance that we had produced for veterinary medicines. And this is exactly designed to do what it's designed to give guidance as to how to put a dossier together that will meet the regulatory needs without being too burdensome, because we understand that the approaches are different. I mean, phages, you can't see them as a discrete entity, and this causes some challenges in trying to evaluate what their impact is. So I think if you look at the guidance that we've published, this gives a pathway to enable bringing effective phage therapies to the market.
Thank you. Francesca, I'd like to go to you next. You said in your presentation that without robust policy action, resistant infections will remain dangerously high in the EU and EEA countries, and this will add substantial pressures to healthcare budgets, and in fact it already costs on average 11.7 billion euros a year. I just wanted to find out from you what the highest, what part of this equation is the most costly, which is the most costly part to countries, and secondly, I noticed that Italy was a real outlier in the cost graph that you put up there in tackling AMR, I think, and in the productivity loss. I wondered if you could give us any insight into what's so unique about the Italian position.
Okay, well, what makes up the costs are different elements. So there are obviously the costs linked to the healthcare system, which in our estimates account for the larger, a little bit more than the 50% of the overarching costs. And in that, a lot of the costs is really linked to resistance infections being more difficult to treat, and so that entails all sorts of additional treatments that needs to be tried, additionally investigations that needs to be carried out in order to understand what exactly is the infections and how it can be treated. So laboratory tests, more intensive medical procedures, also maybe additional and more aggressive therapies that do cost more, and individuals may be ended up staying for longer in treatments, including in hospitals. So all of that adds quite significant to costs. There are also costs in the community and in the long-term care sector, which we had a spotlights in analysis that were done some time ago, you know, how much the infections are actually quite prevalent and cost quite a lot in the long-term care sector. And then there are the costs which are linked more to the economy. So there are costs in terms of the productivity loss, the fact that individuals will need to be out of the labor market. So they may have reduced productivity when they go back to work. And they may have reduced participations in the labor market. So all of this adds to the economic cost. And I think it's quite important when considering antimicrobial resistance, really to look at the overarching combinations of the cost. Mm-hmm. Now, when you look at the different countries, and so for some of them, the costs are particularly high? Well, that has to do also with the cost of, so both the volume, if you want, the number of infections that would be resistance in a countries, but also the structure of the healthcare system and the cost of treatment those infections in the healthcare system. So it's a combination of specific country-specific factors related to the organizations of the care, and as well as the volume of infections that would need to be treated.
And therefore, I'm assuming, does Italy have a particularly high number, absolute number of AMR infections?
Yeah.
Mm-hmm. And you also said from the latest analysis that the policies will need to tackle the drivers of AMR not only in the human sector, but also in the health, agri-food systems and the environment. These measures have been clearly defined for some years now. We know about the hygiene measures and the prudent use. I'm just wondering why it's so hard for some countries to really take them on board. And even with the cost savings you presented, why do some of them seem so reluctant to change?
I don't think there is really a reluctance per se to change. It's just that implementing measures can be in practice difficult to do. There are ways of doing things which are hard to change. There are, incentives broadly defined that needs to be addressed. And I think it's the overarching issues of changing behavior and changing practices is in practice much more difficult to do than what can be done by sitting in theoretical terms and saying, okay, if we implement these to the full scale and potential, there would be very, very significant impacts. But the reality does require a lot of communications, a lot of convinces not just of the economic and health benefits, but also of the fact that the change would not be a threat to the economic models, for example, of the different actors which are affected on the ground. If we're looking at interventions in the healthcare sectors, changing behaviors of both patients and providers does require a lot of time in terms of communicating, in terms of finding perhaps alternative way of explaining, or encouraging more the use of diagnostics tests to verify whether an infection is due to antimicrobial or to a microbe or to different type of infection. So I think it's more that change behavior, that it's something that does take some time, and it needs to be combined together with actions that try more to demonstrate what is the higher economic and health values of implementing those actions. I think you need to act both at the policy high level as well as at the micro level, at the level of each individual, and what motivates the behavior that this person has.
Thank you, Francesca. Guilherme, I wanted to come to you next. Emma Cook told us that the farming sector has made big progress in recent years in cutting back the use of antibiotics in food-producing animals. And yet there's a really big difference in the susceptibility of antibiotics to certain infections in different countries. And I just wondered if you could talk us through why that is.
I'm afraid I don't have enough insight in what's happening at national levels, different policies, different incentives that are put in place. So it's a bit outside of my remit.
I see, no problem. I wondered if you could explain to us, we've got these new regulations to really drive down the use of antibiotics in the farming communities, and that seems to be working. But is there, what's the policing of that process? Is EFSA involved in really making sure that communities and farmers are really adhering to those new rules?
Yeah, no, not really. The enforcement of those measures is left to member states at member states level. So EFSA is not involved in the enforcement. So again, sorry, I cannot say much on this.
No problem. And I also wanted to ask if there was any evidence at the moment that higher use of certain antibiotics in some countries is directly linked to higher AMR against those drugs. And would that be across species and humans, or just in the species where the drug is used the most?
Yes, so there is definitely a link, a proven link between the use of antimicrobial and the development of resistance. This is shown with the different reports that we do. So here this is something that has been evidenced, and the transmission from animal resistance in animals to resistance to humans, it's also something which is happening. I mean, there is a transfer of resistance all across from animals to humans and vice versa, and with or not having the environment in the middle as a medium of transport or even as a reservoir of resistance. So that's why it's really important to have a One Health approach, not to leave any compartment outside of investigation, outside of action, because the part that you don't watch and don't control, don't measure, and therefore don't act on, well, is the one that will give you the bad surprises and the bad results. So cooperation across the regulatory frameworks, across the different actors, the different agencies, so that all compartments are tackled is a very important aspect of the fight against AMR.
Thank you. Sarah, you're our politician on the panel. I wanted to ask you, do you think the European Council recommendations published in June this year in setting out the targets for using certain antibiotics and reducing the incidence of certain drug-resistant infections, do you think these were ambitious enough?
Well, that's a great question. I think they could have been a bit more ambitious, but I truly understand that there needs also to be a balance with the different solutions that we have out there. However, I would like to see more efforts when it comes to tackling this crisis, because if we reach a place where Dr. Emma Cook stated a pre-antibiotics place, that will have severe consequences for the livelihoods of everyone here. I mean, the discovery of antibiotics was one of the three main discoveries in the last century that truly made us improve decades when it comes to life expectancy, together with vaccines and with water and sanitation. So I wouldn't like to face a reality where these very important tools that we have, not only for treatments, but also for prevention, in some cases are not available anymore. So when it comes to lists or targets, I'm usually on the more conservative side, in the sense I would like to see them more conservative in regards to protecting the substances that we have out there.
Understood. And talking about the incentives for developing new antibiotics or other interventions, what's your position towards the transferable voucher idea, which the European Commission has put forward? This is the idea that companies would get market exclusivity for any other chosen product if they bring forward a new novel antibiotic. Where do you stand on that?
That's an ongoing discussion here in the Parliament. I actually had the opportunity to suggest my teams and my own idea for that, which will be in the acceptance period and not on the transferability part of it. I'm very much looking forward for what the different proposals are at the table, and to understand if we can do one, if we can reach one that can foster innovation, boost the industry, but also make it possible to reach the maximum amount of people possible, so it's available out there for everyone. So in that regard, I'm very much looking forward for the discussions that are up and going in the Parliament. I understand we don't have any position whatsoever at the moment, or a majority position, but it will be interesting to follow up on the different discussions and the different proposals proposals up there. There's the voucher, but also there's other proposals, even on agencies. So I would like to wait and see how the negotiations go forward.
Fair enough. Staying with you, Sarah, we've obviously got the European elections next year. What needs to happen to really make sure that AMR remains a priority for the next European parliamentary mandate? How can we make sure that that carries through?
Well, that's an excellent question. First and foremost, there needs to be understanding on the importance of these elections for everyday's life. For instance, in Portugal, 70% of the legislation comes from the EU. And I'm not talking only on that we need to have health champions. We need to have health in all policies champions as members of the European Parliament, because I'm quite worried on the oncoming results and also the different changes already having in mind the elections. And I understand when it comes to climate, when it comes to health, those are policies that are not very easily sellable, in the sense that you don't have results in 4 or 5 years time. You have long-term results, so it's hard to sell as a huge accomplishment from your mandate, and to have that long-term vision, which doesn't follow the political legislative cycle. But it's important to have this in mind when we are explaining and transmitting what the EU does for us, because it's the difference in having wider use of antibiotics, for instance, in agriculture, when we should have those safe for humans.
Understood. Thank you, Sarah. We've got a couple of more questions from our watchers online, both for you, Dominique, at the ECDC. The first question is from Jan Heyer, and he's asking, according to ECDC data, Finland and Germany have achieved good results in reducing antimicrobial consumption. What have they done differently from other countries? And do these countries place more emphasis on raising public awareness?
Well, thank you. Everybody noticed that there are some good countries, in quote, and there were good countries 20 years ago, 30 years ago, when we started digging into the data on consumption and resistance. And there are countries that obviously are doing less well at the other end of the spectrum, and they were still in this position, same position 20 years, 30 years ago. So everybody moved down, I would say, with a few exceptions. Everybody's improving, and this is reflected in the EU mean. So those countries start with a very good background, I would say, structure, processes, culture about antibiotic in the society. And where they asked, because they're already low on the scale, to achieve a reduction target, which is very reasonable, because I think the Commission and the Council didn't want those countries that already were very good to reduce antibiotics to a certain level that it would actually affect patient safety, because patients that would need antibiotic would not receive them because the policy was so strict. So they just had first, they're good in the first place. They have a good structure, processes, culture, education about antibiotics. And number two, they have a target that is very reasonable to achieve. So that's why I think that's why they did well.
And you spoke there, Dominique, about it's almost a culture of the way that they use antibiotics. Emma Cook mentioned, really sharing best practice throughout Europe. Are these countries in the Nordic regions sharing their best practice in how to sort of share that culture of good use of antibiotics?
Can I? Well, I can pick examples. One is that they do more often tests, whether CRP to find out whether it's a viral or bacterial infection in children, or a rapid test for detecting group A streptococci. But it's also easier for them to do it because it's reimbursed by the system. And then the test is done not by the GP themselves. It's done by a nurse working with the GP, possibly an assistant. And then the nurse or the assistant has instructions to, if the test is positive, you issue prescription 1. If the test is negative, you issue instruction or prescription for something else. That's one. Another one that I can think about is the whole society. I'm commuting with 3 Scandinavian countries. Work in Sweden, I commute with Norway, and I worked 11 years in Denmark. And what I see is that there's more awareness in the society about what antibiotics are in the first place. And the countries that have had campaigns have managed slowly to change this. I'm thinking about Belgium, I'm thinking about France, those countries that's having public awareness campaigns. So we're building the future. We need to do these campaigns now. We need to probably do campaigns in schools to make sure that the future parents and the future professionals come with the mindset of, oh, it's antibiotics, so I need to be careful. And then that would also affect the practices of the veterinarians and other health and animal health professionals. So we're on a long journey. We started this journey with the European Antibiotic Awareness Day 16 years ago. Some countries had started before that, and it's because of these good practices that we were able to move forward, and we just need to continue.
Fantastic. Well, thank you so much for sharing those good practices with us. I think they were both really insightful. That's all we've got time for in this panel discussion. So a big thank you to all of our speakers for joining us today for what I think has been a really interesting, insightful and engaging discussion on AMR. Next, we move on to look at the patient perspective of AMR. We've talked about the burden of AMR to economies and what measures countries, healthcare professionals, farmers, citizens need to take to drive down soaring levels of drug-resistant infections. But behind each and every one of these figures is a patient. Last week, I spoke at length with Areti, a 25-year-old pharmacist from Greece, whose story had us both in tears. But Areti was one of the lucky ones. When she was just 13 years old, Areti was diagnosed with leukemia from a routine blood test. It was a real shock to the family, and it meant that Areti had to be admitted to hospital in Athens, 2.5 hours drive from the family home. Her mother also moved to Athens and spent every day with Areti, sleeping at a relative's house in the city. Her father and 2 sisters, one aged just 4, the other aged 17, would visit her every weekend. And it was a really difficult time for the family, but it would get much worse. At the hospital, Areti went straight onto chemotherapy treatment. During this time, she felt good. She felt lucky. She seemed to be able to cope well with the treatment. She felt strong. She could walk around the hospital, pushing her IV stand along. She made friends in the hospital, other patients, as well as building strong relationships with the staff who cared for her. She underwent chemotherapy treatment for 2 months, not leaving the hospital, and the treatment was working. She could feel she was fighting off the cancer, and doctors told her that soon she would be allowed to take a day out of the hospital, and she was really looking forward to this. But then the infection came. Very quickly, Areti's condition deteriorated. She lost her energy, she felt really unwell. She had constant fevers, and she could no longer walk. Doctors discovered that Areti had contracted a multi-drug resistant infection, Klebsiella pneumonia, which had colonized in the site of a large cannula that had been inserted close to her heart to allow high doses of medication for her cancer treatment. And that's when everything changed. These large cannulas are inserted in theatre under a local anaesthetic. Areti had to undergo surgery again to remove the infected cannula, a process that scared her since she knew this meant her cancer treatment would have to be stopped. She then underwent course after course of antibiotics to try to kill the infection. Her immune system was in decline. She felt horrendous. She couldn't eat or sleep. She told me one of the worst effects of the diseases and the treatments was inflammation in her mouth. And this was unbelievably painful, she said, and it kept her awake at night. Areti told me through a translator, it was very painful, not only physically, but mainly psychologically. It was hard to realize that, okay, up until now, I had a really serious disease, cancer, but now I have something even worse that threatens my life. So it was really difficult to handle for me and my family. The situation was made even harder to handle by the fact that now her family were not always allowed to see her in the hospital room. It all depended on what her blood cell counts were doing on that day. That meant some days she could only see them through the window. Meanwhile, for Areti's family, they had to wear face masks throughout the week to avoid any infections in the community, so they could see her at the weekend. This was before the pandemic, Areti said, so it was really hard for them too. Areti underwent surgery again to have another large cannula fitted close to her heart. This meant doctors could give her higher doses of antibiotics. Areti's doctor told me that they used every antibiotic in the hospital to try and kill off her infection. Thankfully, after 2 months of treatment for the infection, Areti started to improve. It was an enormous relief for the family, her friends and staff, and everyone around her. Once she was strong enough again, she resumed her chemotherapy treatment. When Areti was first admitted to hospital, doctors said she could have started taking day trips out after about 2 months. But because of the infection, Areti spent nearly a year in hospital in total without leaving. Today, Areti is one of the lucky ones, and she's very aware of this. She says this experience spurred her to work in healthcare to try to raise awareness of the dangers in overusing and misusing antibiotics. Working in a pharmacy in Athens, she tells me people ask her every day for antibiotics without a prescription. This used to be standard in Greece only until 3 years ago. And Areti informs them of why antibiotics should not be taken unless a doctor has prescribed them. She explains to them the risks of antibiotic resistance, but unfortunately, she told me that many patients say they will go to the pharmacy down the road and get it there. This highlights the really big problems facing Greece in changing habits and educating not only citizens, but also healthcare professionals. But Areti, at least, is part of the movement for positive change in Greece. Next, we're going to be joined by another patient whose experience has also spurred her to work to improve the voice of patients across policy and regulatory settings. Borislava Ananieva is a 2-time kidney transplant patient, originally from Sofia, Bulgaria, and currently living in Belgium. Welcome, Borislava, nice to see you. I can't hear you at the moment.
Can you hear me now? Well,
yes, I can hear you now. Thank you.
Thank you for having me.
Welcome. So I understand you work as a Youth Strategy and Capacity Building Officer at the European Patients Forum, as well as the coordinator and founding member of the forum's youth group. Borislava, first of all, can you share with us your patient story? I know you've also experienced an infection with multi-drug resistant Klebsiella pneumonia like Areti, but on top of that, you've had double kidney transplant. Were the two things connected, and how did being an organ recipient impact your infection treatment?
Thank you very much for the question. So my chronic condition is since birth, so really not affected by any medication I've taken. I was born with only one kidney that wasn't working in its full capacity. Normally, if it's working in its full capacity, a healthy human can continue living with one kidney. But for me, this was not the case. I had my first operation at 2 years old. I had my first kidney transplantation in Pakistan when I was 9 years old. And I had my second kidney transplant in Turkey in 2018. So quite a lot has been going on with concerning my health. And unfortunately, ever since my first kidney transplantation, I've had to take immunosuppressants daily, which can definitely impact a lot the health status of any person that takes them. And especially when the person has an organ transplant, the dosage of immunosuppressants that they need to take is quite a lot. So in this case, because of my low immune system, I am much more easily affected by any and all infections around me, unfortunately. And that means that, for example, 2022 was absolutely terrible for me in that regard. I was in the emergency room 4 times with severe infections. I was on antibiotics more than 8 times. And as you can imagine, that can definitely impact the future of my treatment. For example, in 2023, thankfully, I was in the emergency room only once, which I know it sounds terrible, but it's very much a progress on my side. And when I was in the emergency room, I was diagnosed with exactly the same bacteria that Ariadne had, so Klebsiella pneumonia. And of course, also because of my previous numerous treatments with antibiotics, the bacteria was sensitive to only one antibiotic out of all of the available ones, which was quite scary to hear. And I had to undergo an IV treatment in the hospital, being locked up for a week, not allowed to see other people or go out. Was quite intense. And to be fair, the only antibiotic that could actually do something about my infection was quite toxic and very heavy. So it was a rough journey to go through, definitely. And it made me, how can I say, practically understand the importance of AMR.
Gosh, that sounds like a real ordeal for you. And was that in 2022 when there were lots of infections, or was it in 2023 that you got
2023, this year.
Yeah. And how long did you spend in hospital in total with that infection?
With that infection, it was a week, so quite quickly things were under control. But before that, I had quite a few urinary tract infections, like all kinds of different infections all the time. That in total, I can't really count how much time it took me. I even had to go on long sick leave in order to try to deal and really recover well from all of this, because it's just too much at a certain point.
Gosh, and I think you've really kind of painted a picture here. I mean, we've spoken to 2 young, looking very healthy women on our research for this, and to hear your stories is really quite a shock. And obviously, anyone on immunosuppressants or with immunodeficiencies is going to be more susceptible to getting a drug-resistant infection.
Absolutely, yes.
I wanted to ask you about the European Patients Forum, and it's also part of the AMR patient group. And I wondered if you could tell us what this group does and what it's trying to achieve.
So the AMR patient group is an initiative of Health First Europe, and it's also joined by the European Patients Forum, as you mentioned. It was launched in November 2020 with 30 national patient organizations from all over Europe. The main aim is really to address the gap on a patient level about the dangers of misuse of antibiotics and the lack of infection prevention measures, which is quite key, and I don't think it's spoken about enough, especially when it comes to people with chronic conditions. It also raises awareness on when to take antibiotics and how to do it responsibly, because like you mentioned, originally I'm from Bulgaria, and the practice there is very much similar to what Ariadne mentioned before. People think that antibiotics can cure, I think, almost everything. So at any point when they feel they're getting worse, they just jump to the pharmacy, get whatever antibiotic is available, and they just start taking it for whatever time they decide, basically, which is very much a no-go. Yes, and a few other of the main aims of the AMR patient group is including infection prevention in the AMR debate, raising the consistent patient voice across Europe to advocate for national policies to tackle AMR accurately. So really more also on the national level.
And how do you really go about reaching patients, and how are you, getting? Are you speaking with them face to face? Are you producing guidance for patient groups? How do you reach these patients who need to be reached?
I can answer on that more on the EPF side. So the European Patients Forum also has three main pillars that we're focusing on currently. One of them is to raise awareness of the specific risks and challenges faced by chronic disease patients, to explore ways to engage the patient community at a global level as well, in line with the One Health approach, of course. And EPF recently joined the AMR multi-stakeholder partnership platform led by the WHO, FAO, and many others, and to promote the prudent use and research and development of new antimicrobials with a key focus on ensuring patient access to potentially life-saving new products in policy discussions. And to answer your question, for example, in the capacity building team and in the European Patients Forum, what we do is really provide our membership, which is other umbrella organizations across Europe focusing on different disease areas and coming from different countries, is we really try to work a lot on providing some knowledge and tools that are necessary for patients to fully understand why this is important and why they should also continue distributing this information on a national level to their members. We are providing toolkits, we're providing all types of sources that we find helpful, including the ECDC ones. So it's quite a lot. I wouldn't say that every time it's a direct hit, but we're doing what we can to spread as much awareness as possible.
And Dominic mentioned, we need to really start educating children in schools. And I wondered if that's part of the work that you do.
At schools directly, not really. We have a youth group, so we're focusing sometimes more on raising awareness in the youth community across Europe. So far, it's worked very well for other topics, not precisely for AMR, but EPF will be working in 2024 and following that a bit more focused on AMR. And I hope that we can also include this in our action plan.
And how do you measure success? One of the examples that Dominic gave us again about the difference in behaviours, the cultural differences between some of the northern European countries and the southern countries, like Bulgaria, as an example, are really quite stark. And I just wondered how you really go about changing behaviour, and if you've seen any successes in that regard.
I think we've definitely seen some successes in that regard. And I think it was mentioned in the previous panel as well, where I really believe the most key thing is to open the conversation and start from the start, from the actual start, to explain what antimicrobials actually are, what are they used for, what will they not work on? Because I really believe this is something that is missing quite commonly in the understanding of the general society and larger patient community. So really explaining the basics, because I feel sometimes we get so trapped in the details that we really miss why are these things there in the first place? Why do we need to do this? How it needs to be used? And what are, let's say, the three most important things that you need to know when dealing with antimicrobials? And so far from what I've seen, when you provide the basic information in a very understandable and lay language, and you open the conversation for people to really come across with questions that might not be too sophisticated, it really brings a better understanding in all people. And as we're joking, that thankfully somebody in the room asked the question so all of us can understand. It's something similar, I believe, for this too.
Well, you've just raised one of the issues that I have as a journalist. Trying to tell the story about AMR can be very difficult because the terminology is so complex and often people can turn off. So how do you really go about producing that lay language? And I'm particularly interested to learn from you as well.
So, for example, when we need to forward some information that will be in lay language and easily understood, we have a few people at EPF that are very good at what they're doing in that. And it really depends on the topic exactly, because we all specialize in different things. But we really try. Recently, we did something on shortages, for example, which is also very, very much connected to AMR. And what we did was we asked one of the speakers who was from the EMA to just imagine that the crowd that she's presenting to has absolutely no clue what she's talking about, no abbreviations, nothing like that, just to really imagine that people have no idea what you're talking about. And I think that that approach can be used quite well in other discussions as well.
Absolutely. Thank you so much. And just a final reminder, I mean, you've touched on it already. I wanted to come back to what you do at the European Patients Forum in really capacity building among young patients. And to what extent does this really talk about, does this bring AMR into that discussion?
So far, we haven't really focused at the youth group on AMR, but it's something that is definitely on our radar. And also, I think it will be a bit easier to communicate to the young patients community about this because we've seen a lot of great examples on the EU level where it's very easy to understand information provided online. And I think that younger generations will be a bit easier to reach with easy to understand information, and hopefully that can also improve their knowledge on such important topics.
Wonderful. Thank you so much, Borislava, for joining us today. That's all we've got time for with you.
Thank you, Helen.
I think there's in fact, a community of patients and professional organisations throughout Europe and globally that are working in many ways to help prevent AMR. So next we're going to look at some of these groups. I'll be listing a few of them shortly, but first a reminder for those who are watching us online, do please post on social media about the event European Antibiotics Awareness Day or Antimicrobial Resistance using the hashtag EAAD. And we'll take a look at some of those social media posts in a short while. So like the European Patients Forum, there are several patient and professional organisations that have a role in addressing antimicrobial resistance. Many of them have been long-term supporters of the European Antibiotic Awareness Day and work tirelessly to raise awareness about this public health issue, to empower professionals across Europe and to drive action at European, national and regional levels. They are present here today at the event, so hopefully we'll see some of them in the social media wall in a moment. You can find out more information about these organisations also in the exhibition area of this digital platform and also on the front page under supporters. I'd like to take the time to mention just a few of them. The Standing Committee of European Doctors, or CPME, has accelerated efforts to advocate for more European action on AMR. In April, they published their new policy on AMR, recalling that prudent prescription use of antibiotics is a responsibility for each and every practicing doctor in Europe and worldwide. The European Community of Pharmacists, represented by PGEU, plays a key role in infection prevention and promotion of antimicrobial stewardship through a range of professional services. Pharmacists provide patients with high-quality information on the appropriate use of antimicrobials to ensure adherence to treatment. They also raise awareness about the correct disposal of antimicrobials through having in place pharmacy-led disposal and collection schemes. MedTech Europe on the industry side is the European Trade Association for the medical technology industry, including diagnostics, medical devices, and digital health. They work in 4 areas linked to medical technologies. First, in preventing and containing healthcare-associated infections. Second, in detecting and identifying bacterial infections with their susceptibility to medication. And finally, in monitoring and tracking resistance and outbreak management and surveillance. The European Pharmaceutical Students Association, or EPSA, advocates for prudent use of antibiotics and involves its students in the discussions through several actions. They raise awareness actively and believe that educating the younger generations is for a better future, and this is crucial. The European Public Health Alliance raises awareness of AMR as a key challenge to equitable health. But importantly, it ensures that this issue remains at the top of the EU policy agenda. They use evidence to shape policy and practice in a One Health approach and work on AMR stewardship, building skills, knowledge and capabilities across organisations. And REACT is an independent and global network that began 15 years ago to advocate and stimulate global engagement on antibiotic resistance. Their goal is to bridge the gap between social and policy and turning what was then largely seen as a medical and technical issue into one of social and political importance. I've highlighted just a few of the groups that we know about, and there are many, many more, including the European Health Management Association and many more. On our board to the right there, we see several posts. Someone saying we need a One Health approach to tackle this silent pandemic, something we heard frequently in the panel discussion from, I think, most of our panelists, in fact, and many more posts there, which you can see scrolling through. Next on our agenda, we are going to look at the actions taken by EU member states to really drive down rates of antimicrobial resistance. The first person to join us will be Dr. Malin Grape, Sweden's ambassador on antimicrobial resistance since March 2022. Sweden held the European Council presidency for the first half of this year, and during that time, the Council recommendations were agreed, setting out the targets for treatment and infection rates that we heard presented earlier by Andrea Ammon at the ECDC. So Malin, the floor is yours.
Thank you so much, and thank you for inviting me to this event. I'm really glad to be here to speak on behalf of Sweden. So, as you heard, I have been appointed by the Swedish government ambassador on antimicrobial resistance. I'm actually based in the Ministry of Health of Sweden, but of course I do represent the entire multi-sectoral work in the One Health approach that Sweden has, and of course all other EU countries. So today I briefly want to talk a little bit about, again, the mentioned many times today already, the Council recommendations adopted during the Swedish presidency. I will also talk a little bit about the Swedish specific focus that we had during our presidency, and I will give you a glimpse of the Swedish national work ahead. So again, you have heard many times now about the Council recommendations on stepping up EU actions to combat AMR in the One Health approach. But so far during this seminar, and of course it's really relevant, we have been talking about the targets and how to reach these targets. But the entire recommendation, of course, altogether will improve the work of the individual member states and the EU as a whole on the way to reaching these targets. So I just want to touch upon the different areas, and the recommendation consists of 9 different areas for action. And the first one is national action plans against AMR. Secondly, surveillance and monitoring, which we've been hearing quite a lot about today. Third, and which Francesca also emphasized, one of the most cost-effective and important interventions is about infection prevention and control, where we could definitely do much more, I think, in all countries. Fourth, we have stewardship and prudent use of antimicrobials, and then we have the targets as the 5th focus area. Awareness, education, and training is something that we just talked about now, which I think is also incredibly important to have an understanding also for the infection prevention and the stewardship measures that have been implemented. Research and development and incentives for innovation and access to antimicrobials. Another one which I'll come back to a little bit. And then we have cooperation, which is also something that we are doing here today, or starting up here today, an opportunity to connect and see how to work together forward. And we have the global aspects, which I will also come back to a little bit. So during the presidency, the Swedish presidency of the EU Council, maybe very early agreed to have a focus on AMR, just as the last time we had the EU presidency in 2009, AMR was on top of the agenda. And we, of course, we were lucky to have the opportunity to actually have the council recommendation proposal presented. It was quite late, but we are so grateful to all the member states for the cooperativity and the willingness to really agree during the negotiations. So we did this in an incredibly short time, and these were adopted in June in the EPSCO Council. And we're really happy for this. But in addition to this, we also organized a high-level meeting in Stockholm in March, which had a dual focus. So we partly talked about how the EU can contribute to the progress on global level. And we have a critical year ahead of us in the global work on AMR. And then we had another focus, which was on access to new and to existing antibiotics. We really wanted to see this and wanted the participants in this meeting to see the connection between access and development of new antibiotics, how to stimulate innovation, but also assure that we do have access and reliable access to all the existing ones that we need to safeguard the new ones, but also to optimize and to decrease the pressure and the resistance development. So we organized also, in addition to the high-level meeting, an expert meeting where we had an opportunity to really dig a bit deeper into the challenges, but also many possible options and measures to meet these challenges. And I could say that in conclusion, we all agree, I think, that we need a package of different type of measures and incentives for the sustainable and reliable access to effective treatment of infections also in the future. Very briefly, also on the national level and connected with the access, I think many of you may have heard that in Sweden we have piloted a revenue guarantee model where we pay for access to a number of key antibiotics of special medical value while delinking this reimbursement from the price and the volume of sales. And this model is a similar one to the one that will now be tested on a voluntary basis also on the EU level. So we very much look forward to this, of course, the development. And this model will in Sweden also be developed and adapted to be piloted for access to existing older antibiotics to assure reliable access also to these. Further, we do plan now to revise and update our national action plan or strategy on antimicrobial resistance. And before that, we will do a thorough review of the current strategy and the progress so far. And as part of this, we very much look forward to welcoming the ECDC team for a country visit sometime during the next year. So I think this is going to be very important for us in the development of the new strategy. And of course, this review is very timely also since we now can update in accordance with the adopted council recommendations to make sure that we can accelerate progress towards the agreed targets. Thank you very much.
Thank you very much, Malin, for sharing with us everything that Sweden's been doing, especially during its time during the council presidency. I just wanted to ask you, I mean, we've talked a little bit about best practice in this meeting, and obviously Sweden is an example of a country which arguably has done very well when it comes to stewardship and prudent use of existing antimicrobials, even being exemplary in Europe, if you like. Why do you think that is? And I wondered, we've also talked about, and I'm seeing in the chat, discussions about education in younger people and in schools, and I wondered what the public health campaign has looked like for Sweden over the last few decades, and whether or not it has included any campaigns or education in the school setting.
Thank you. That's a lot of questions. But first of all, I really want to emphasize that, yes, Sweden, we have been quite successful. We also have a very long experience in this area. So I think part of our low levels, both of use and resistance, are a result of us starting this very early, already in the mid-90s. The STRAMA, the National Stewardship Program STRAMA, started. And even before that, in 1986, Sweden banned the use of antibiotics for growth promotion in animals. And that is 20 years before the same legislation came into place in the EU. So I think we should also, we should be aware of the time that it takes, and also, we lack time now. It's an urgent issue, but at the same time, you have to be a little bit patient also. When it comes to public campaigns, yes, we do have public campaigns directed towards consumers, towards pet owners, for example, towards patients. And I think it's maybe not so much about educating about bacteria and viruses, but rather to promote a prudent and adequate behavior. So rather reinforcing how to do this, to talk to your doctor about whether a prescription is necessary or not, or to return your antibiotics to the pharmacy instead of keeping them for the next infection, or throwing them away and risking end up in the environment, for example. When it comes to schools, we actually also do have this as a part of the school curricula, which is, of course, really beneficial, but again, we can never do enough, I think, in raising the awareness and really advocating for more action on this topic.
Very interesting. Thank you so much, Malin. We next go to our next speaker, who is Mr. Antonio Lopez Navas, who is head of the Executive Director's Office at the Spanish Medicines and Medical Devices Agency and coordinator of Spain's National Action Plan on AMR. Spain currently holds the presidency of the European Council, and although AMR is not specifically mentioned in Spain's programme, the presidency has held an event on AMR only last month in Pamplona. So, Antonio, the floor is yours.
Thank you so much for letting Spain to explain the situation, and in particular where we are as a national action plan, and how we are dealing in a country like mine, where the situation, you will see, was completely different to the Swedish colleagues, for example. I will briefly explain how we translated the Council recommendations and targets, and how we are adapting these targets to our particular situation. And if I have time, I would like to briefly present some of the ongoing projects, the main ongoing projects that we have in Spain. So next slide, please. I will start with where we are. I would like to say that Spain has a pure national, One Health national action plan that includes human and animal environmental sectors. The national action plan is coordinated by the Spanish Agency for Medicines and Medical Devices, where I work. We have a common coordination committee and a common advisory committee for the three domains, and also we have 3 coordinators for each of for animal, human, and environmental that work together in a daily basis. Next slide, please. In the next slide, you will see, in this one, you will see that our work is based on these 6 strategic lines that are pretty similar to that included in the European Action Plan, in the Global Action Plan of the WHO, which is surveillance of antimicrobial use and antimicrobial resistance, control of the use of antibiotics, prevention of the infections, communication and awareness campaigns, training and education, and finally research. Next one, please. And in this slide, you can see where are we right now. We are in the 3rd action plan approved. We started our work in 2014, trying to have all the relevant actors that played a role in the antimicrobial resistance, that is all stakeholders. We started establishing regulatory frameworks, common indicators, and the different surveillance system. In the second one, we work trying to implement all these actions, and now in the third we are consolidating all of the actions that we have been working. Up to date, we have more than 60 documents approved by this coordination committee, and also we already implemented up to 80 actions in all three domains, in human, animal, and environmental. Next one. This all leads to reduction in the antimicrobial sales in the veterinary field of 69%, and also a decrease in the use of antimicrobials in the human field of 17%. It means that we are the highest. We have the highest reduction in Europe in the animal health, and the third country with the highest reduction in the human field. We are fully aware that our situation was, we were at the top 3. But these figures, these very significant decreases in the antimicrobial use and consumption only means that we are in the right direction and that we still have a lot of work to do. So next slide, please. I don't know if you can see the presentation. I cannot. Hello? Are you still there? Hi. Yeah. Now it's working. Yeah. Can I have the next slide, please? Okay, that one, yes. In this figure, I just want to mention that it's not only a question of quantity. Let's say that, for example, my colleagues in the veterinary field were able to reduce in 8 years almost 99% the use of polymyxin or colistin that you are aware that are critically important antibiotics for the human field. Now I will move on to the recommended targets. Next slide, please, and how we adapted them into our particular situation. The executive, next one, please. The executive director of the ECDC presented the global target of 20% reduction in the whole European Union, but as you are aware, this council recommendation also proposed particular targets for the different member states. In our case, we've been asked to reduce by 2030 the total consumption in Spain. That was 27%. We still have to get that 65% of use of antibiotics belonging to the accessible category. And in the case of the incidence of bloodstream infections, our particular targets are 10% reduction in MRSA and third cephalosporin-resistant E. coli and 4% in carbapenem-resistant Klebsiella pneumonia. Next one, please. For the veterinary field, there is no adapted target. It's based also in the EU Farm to Fork strategy. That is a 50% reduction in total sales of antimicrobials. Also to adapt at the local level the list of antimicrobial reserved for human use only, and to make an effective implementation of antimicrobial stewardship also in the veterinary field. Next one, please. When we received the proposal of the Council, we start a working group within the framework of the National Committee Coordination Committee. We sent, you know that a particular organization in the human field, we have 17 autonomous regions. In the screen, you can see the situation of each of them. We have a very heterogeneous situation. We have autonomous regions with an antibiotic use below the objective established by the European Council, and we have others that are very high above this target. So what we did was send them their initial situation according to the 2019 year. We make them a proposal for reduction. We make them a contingency plan, adapting what is proposed in the National Action Plan and adapting to their individual situation, what they should focus their attention and what they should prioritize for the next year. These targets were presented to this coordination committee. We agreed to have a 3% reduction each year till 2030, and we adapt this 3% target to the different. Next slide, please. And we adapt this 3% reduction to the autonomous regions from going from 3.3 to 2.2, depending on the situation of the different autonomous regions. We also have very interesting discussions within this working group regarding the proposal. We would like to have or to know what was the methodological approach followed to advise the global 20% target, and also to this adopted target to 27% for Spain. We don't know if this target has been linked to health outcomes or to any quality indicators, for example. Greater effort is requested to countries with good results in terms of health burden, meaning morbidity and mortality related to infections produced by antibiotic-resistant bacteria, than others that have worse figures. Therefore, we would like to see the reasons behind these 27% recommended targets. Other discussion, interesting discussion, is about the metric itself. For example, the defined daily dose that is used in ESAC network, and that which data were used to calculate the targets. It's based on the registered population, and for example, in Spain, the floated population is not considered in that denominator. I'm talking about the people who reside in Spain for a certain amount of time and for various reasons other than the tourism. And you can see one example in the screen. The population, for example, in Balearic Island increased between 30 and 70% during 7 months a year. Or, for example, the population in the Canary Islands increased from 2.3 million to 6 million between April and September. And this floating population is not considered when making calculations. In addition, Spain has also an important population over 65 years. This floating population is normally also over 65 years. At least in Spain, we tend to be more conservative with these people, and because they have fragility and comorbidities, so in clinical practice, we tend to use more antibiotics. It means that ideally, these targets could have been stratified by also age group. But despite all of these general comments, we, as I say, accepted this proposed target of 27% reduction, and we adapted it to our local situation. Next slide, please. Next one. That one, yes. Here you can see the situation in 2008, which is the baseline situation for the 50% reduction. Till now, in the veterinary field, my colleagues were able to reduce already 30% of the sales of antibiotics. Or again, they are in the right direction. We still have to reduce a lot. As I said, we have significant decreases, but we are fully aware that we need to a lot of work ahead. So I don't know if we'll be able to reduce to this 60 milligram PCU that is proposed for Europe, but I think we will be able to reduce the 50% of our sales by 2030. Next one, please. And now I will explain you some of the ongoing projects that were put in place in Spain to be able to achieve this reduction I mentioned. Next one, please. I will start with surveillance. Next one, just to mention that since 2016, we have publicly available interactive maps to have access to antibiotic use in Spain, both in humans and both in animals. As I said, these are publicly available. You can go there, check the quantity and quality indicators of use in Spain. You can do it by regions, nationally, and it can be done in a yearly basis. But under request, someone can go and make this analysis in a monthly year. As I say, this is publicly available. Next one, regarding antimicrobial use, we also established an electronic prescription system for veterinarians, and so we are able to know how antibiotics are prescribed in the veterinary medicine. We also approved national surveillance system for epidemiological pathogens data, meaning that we can now have knowledge about the resistance in the diseases animals, which is something completely new in Europe. We are starting what we call EARS-BET network, and that will be, for example, developed within the next joint action on antimicrobial resistance. In the human domain, we approved a couple of years ago the National Reference Laboratory Network and the regulatory framework for the surveillance of antimicrobial resistance and healthcare-associated infection. All of this is just to give you an example of what we have done to have the complete and global picture of the antimicrobial resistance and antimicrobial consumption situation in Spain. Next one. Next one, please. Another situation that is requested in the Council recommendation is to have effective implementation of antimicrobial antimicrobial stewardship, both in human and animals. In human, for example, we created a certification and audit system for antimicrobial stewardship in hospital and primary care. We developed guidelines and standards for this certification and for these audits that serves as a guidelines for the implementation. We are also developing an artificial intelligence tool for hospital in order to support these antimicrobial stewardship teams. And also we established a national stewardship committee similar to that existing, for example, in Sweden. All of this in order to boost the implementation of these antimicrobial stewardship teams in hospital and primary care. Next one. The same is true for antimicrobial stewardship in veterinary medicine. Here we call this antimicrobial stewardship reduced programs in the animal field, which are voluntarily, they are aimed at reducing the use of antibiotics, also include the management, biosecurity and hygiene measures, and also the implementation of treatment guidelines. These stewardship teams, next please, are already implemented in all sectors or the main sector in Spain, including a small companion animals. So they are working. Thanks to these reduced programs, they were able to reduce this 60% on the sales of antimicrobials in veterinary medicine. Next one, please. We've implemented a lot of training and education measures. We've provided training to more than 2,000 healthcare professionals, also in hospital, primary care, in veterinary animals, and so on. We also provide for the university degrees what we call Pranteca, which is our repository of documents, information, and multimedia resources, practical cases for teachers to be used. We have more than 28,000 active uses of this Pranteca, so it's been used at the university level. Next one. We also provide our colleagues with national treatment guidelines in human and animal health. They are providing an app for mobile phones, but also in the web page. We know that currently we have more than 30,000 active registered users, and we know that since January beginning this year, we have had more than 2 million visits to the guidelines in our web page. So in addition to that, we've conducted several national awareness and education campaigns for not only health professionals, but also to the general public. So a lot of activities aimed at to reduce or to promote the prudent use of antibiotics. Next one, please. Okay. So you can see that in Spain, these targets were more than welcome. I have to say that in Spain, we need this proposal to push the autonomous regions to agree on these national and local targets. We had in the past previous attempts to, but not with no consensus. And after the publication of the conclusions, we have the opportunity to agree this common goal. Now we have a common goal. And despite the reserve mentioned about the methodology, the National Coordination Committee adopted these proposed targets. Now we are working in adapting the difficulties of each autonomous region to do so. Our conclusion is that in Spain, I think we are doing it well. We establish the proper structures and processes, the different actions that translated in a very significant decreases in the antibiotic use in Spain, but we are also fully aware that we still have a lot of work ahead. But according to results, we know that we are in the right direction. Thank you so much.
for your presentation. I think you've really highlighted some of the more nuances of the targets that have been presented in the Council recommendations, and some of the things that perhaps we haven't thought about, fluctuation populations and how to measure these things. I just wanted to ask you a quick question based on one of the earlier presentations we saw today, which showed that among the farm-producing animals in Spain, very few cases of E. coli infections are susceptible to antibiotics. I just wanted to ask what's really happening in Spain to really try and turn around that figure.
Yes, we are. According to an analysis of the formal surveillance system that the Ministry of Agriculture have, we are observing some turning out in the incidence of this kind of infections in diseases animals. Yes.
Thank you. We go to our final speaker for the plan today, who is Professor Dirk Ramakers, Chairman of the Executive Committee of the Belgian Federal Public Service for Health, Food Safety and Environment. Dirk has been active in healthcare management and policy for over 20 years and has overseen changes to drive down AMR in Belgium. Dirk, the floor is yours.
Yes, thank you, Helen. Good afternoon. I would like to thank particularly the ECDC for orchestrating this remarkable event during the European Antibiotic Awareness Day. Today we are reunited for a cause that demands our immediate attention and concerted action, the fight against AMR. Next slide. Before diving into the heart of the subject, allow me to share that on the 6th of December this year, our Prime Minister, the Prime Minister of Belgium, Alexander De Croo, will present the EU presidency priorities for the next presidency, the Belgian presidency of the Council of the European Union. This announcement will set the stage for a strategic and coordinated approach to address the challenges that lie ahead, with AMR as the frontrunner of our collective concerns. Our mission gains strength from the inspirational words of Christopher Fern, Deputy Prime Minister and Minister for Health of Malta, saying, "We are the first generation living in the antibiotic era. Let's make sure we are not the last." These words emphasize our shared responsibility in preserving the effectiveness of antibiotics for the generations to come. Next slide, please. During this important World AMR Awareness Week, Belgium launched a specific targeted AMR campaign on dentists and also on horse owners, as you can see, acknowledging the diverse pathways through which AMR affects our societies and recognizing the urgency of the situation. The strategic choice underscores our commitment to raise awareness among varied groups within our communities. Dentists, as frontline healthcare providers, play a crucial intersection of human and animal health, in responsible antibiotic use, and also, of course, horse owners represent a unique intersection of human and animal health and are essential in our One Health approach in combating AMR. Awareness raising is only one of the main tools to slow down the spread of AMR and resistant pathogens. And as Mrs. Sandra Galina urged during the Transatlantic Task Force on AMR, we cannot afford to let the gravity of AMR go unnoticed, and therefore the term silent pandemic is no longer appropriate. We need to find a new terminology that will leave a lasting imprint in the minds of patients and healthcare professionals. Our message must be clear and resounding. The fight against AMR requires a united front, transcending boundaries and sectors. It is only through collective awareness and understanding that we can hope to address the multifaceted challenges posed by AMR. Next slide. Coming back to the Belgian presidency, I am delighted to announce the upcoming AMR high-level conference scheduled on 3 days between the 6th and 8th of May 2024. This significant event is made possible by the collaborative efforts of the ECDC. Thank you for that. Our own Belgian scientific institution, Scienzano, and the Federal Public Health Service. Day one will see the ECDC HiNet network meeting. together with day 2 hosted by Cienzano. It will be a joint meeting that will focus on combating healthcare-associated infections and also AMR in a One Health perspective. And finally, on day 3, we will host a high-level conference, and we hope to host the majority of the health ministers of the European Union. And on this conference, the main focus will include elaborations on the AMR governance in general, but also the development and implementation of effective AMR targets, the implementation of those targets, results-driven policy measures that can optimize the use of our antibiotics, and of course, strategies to stimulate research and development of new antibiotics while ensuring sustainable access to the existing ones. Our primary objectives are clear: to continue the work initiated by the Swedish and Spanish presidencies on AMR and pave the way for the United Nations General Assembly in September 2024. We aim to present, together with you, a unified EU voice, keeping AMR high on the political agenda of the next Commission. Next slide. As part of the Belgian presidency, the FPS, in collaboration with the European Observatory on Health Systems and Policies, will publish a specific health policy paper. This document will serve as a testament, as a statement to our commitment to provide actionable insights and foster international cooperation in the fight against AMR, and also serve as a comprehensive background paper on AMR for the high-level conference. Next slide. Additionally, the Belgian presidency will also prioritize the finalization of the negotiations on the pandemic treaty and on the international health regulations. Furthermore, we aim to secure the adoption of Council conclusions on the future of the European Health Union, underscoring the interconnectedness of global health challenges. In conclusion, let us all embrace the challenges that lie ahead with determination and with unity. Together, we can build a future where antibiotics remain a powerful tool against infections, ensuring the health and well-being of the generations to come. Thank you.
Thank you very much, Dirk, for your comments on what the Belgian presidency will then go and focus on, especially in AMR. That's all we've got time for today. I want to say a big thank you to all of our speakers who have brought a high level of expertise to the discussion on AMR. They've really shone a light on where Europe stands today and what progress has been made and where more work still needs to be done. I remember clearly attending the launch event of Europe's second action plan on AMR in 2017 under the previous Commission. It was the first one to adopt the One Health approach. Back then, there were 25,000 deaths in Europe attributable to AMR, and today that figure has grown by almost 50%. It highlights that despite these efforts across the sectors, it's going to take a lot of work to really turn the tide on AMR and start to reverse these trends. But today we've heard some really interesting discussions from experts from across the medicine sector, disease agency, food and animal health sector, economics as well, and expertise from the member states, as well as patients and patient and professional organisations. Among the standout comments for me today were things like Andrea Ammon, chief of the ECDC, saying that EU progress can only be as good as the sum of the progress in individual member states. We are all responsible, she said. Emma Cook at the EMA underlined something that I think we've heard repeated quite a lot this afternoon, that AMR as a silent pandemic is a misnomer. She told us we need to shout out and not be silenced. Dirk, as we just heard, told us that we need to find a new terminology to describe AMR, something that will leave a resounding message among citizens. Emma Cook also told us that we were warned about this in 1945 by Alexander Fleming, but we didn't listen until now. But she shared some good news. There's been a significant decline in antimicrobial consumption in food-producing animals, 53% in the last decade and 13% decline in the most recent year of data. But unfortunately, the picture is really mixed across Europe. Guillaume at the European Food Safety Authority showed us that there are huge variations across European countries in how well antibiotics continue to work in food-producing animals, highlighting that there's a lot of work to do in some of these countries. The data were most stark in the southern European countries, with Greece, Spain and Cyprus really standing out. One area of real concern, Guillaume said, was the emerging growth in resistance in carbapenems in animals, a signal he described as worrying. Francesca from the OECD made a very stark statement in the start of her discussion. She said that 1 in 5 infections is already resistant to drugs. In addition, resistance to third-line antibiotics has soared in the last few decades, which is a real concern because these are the antibiotics that people progress onto if their infection is not responding to first and second-line treatment. She said drug-resistant infections cause 9.5 million extra days in hospital a year in Europe, at a huge expense of over 11 billion euros a year annually. But she provided some hope. Spending on well-known interventions from hygiene, infection prevention and control measures and prudent use of antibiotics makes economic sense by providing a threefold return on investment. MEP Sarah Sadas gave us an interesting public health campaign in Portugal. That is one way that one country is really trying to raise awareness of how to use antibiotics prudently. In Portugal, there's a campaign that says, if you have flu, treat it with a unicorn. She said it's ridiculous because it doesn't make sense, because so would using antimicrobials to treat flu. It doesn't work. And we've heard some really interesting and very heartfelt descriptions from 2 patients who have shared their very difficult stories with us about what it's really like to suffer with a drug-resistant infection and the fear that that brought to them. We've heard how countries are working towards really tackling AMR, looking at the new targets that were set out in the Council recommendations this year, particularly from the 3 most recent and current countries with the European Council presidency. And some of the ideas have been beyond those targets, are looking at things like really changing behaviours towards the use of antimicrobials in populations and patients. And we heard how Sweden is even doing this at the school level and providing education around antibiotics use, even in its curriculum. I think we've covered a lot of ground today, so I just want to say a huge thank you to all of our speakers today for joining us online. Please do continue the discussion on social media using the hashtag EAAD. Thank you and goodbye.